Hi there, I'm Dr. Kristina Tansavatdi, and I'm a double board certified facial plastic surgeon, and I specialize in deep plane facelift and neck lift surgery. In this video, I'd like to share with you some of the questions I get in my consultations that I want to address right off the bat. If you are coming in to see me for a consultation, I'm going to be asking you some very important questions. And sometimes patients wonder why I need to know this much information about what injections, what fillers you might have had done, what non-surgical procedures you've had done on the face and neck. Well, let's face it, if you're going in to see your surgeon and you've had previous surgery or you've had previous work on the face, it could affect the outcome from your surgery. And you would like to have your surgeon know all of that information going into the surgery, wouldn't you? I mean, they are operating on your face for several hours, and you put in all this commitment, time, energy, resources, and money to pay your surgeon to do the best job possible. You want to set them up for success. So I'll tell you right now, don't shy away from sharing all the information of what you've had done in the past. And that includes, number one, fillers. Hyaluronic acid fillers, if placed in certain areas, will be seen by the surgeon when I do the facelift procedure. In certain areas, particularly around the mouth, these nasolabial folds or smile lines, they kind of prevent me from getting the best pull. The other reason why I would need to know is hyaluronic acid fillers can disrupt the lymphatic drainage in the face. So now you're dealing with prolonged swelling and healing time after the surgery. And you'll wonder, well, why is that happening? Well, it could be because you've had previous filler in the face that hasn't been removed or dissolved, and fillers can last a good long time in the face. You'll be surprised, it could last you years, like 7 to 8 years. The longest I've seen has been 8 years in the face. So it's a long time in the face. The other thing that you would want to know is, your surgeon would want to know, is about any previous fat grafting. So fat grafts in the face, when I've done a facelift before, didn't know that fat was living in the face. These grafts, fat normally lives in certain spaces in the face, but fat grafts, if it's done by a surgeon who's injecting these fat grafts, it can go into right under the skin, it could go in deeper tissue, it could be found in the muscle. And I'm dissecting in this area to lift the muscle. So that's going to disrupt the ability for me to do the best procedure for you. So those are important questions to ask yourself and to give that information to your surgeon. Fat grafts, hyaluronic acid fillers. A third procedure that I see a lot done is ultherapy. Now, that was done in the past, but now we have other procedures such as soft wave, which is a newer technology, hyper-focused ultrasound technology, and now you also have radio frequency technology. Some of these devices, they go deep, but they don't go under the muscle. And that's one thing I have to tell you about a facelift that's different than all these non-surgical devices. When you invest in these procedures, they're treating the area between the skin and the muscle, and only surgery can lift the muscle and address what we are seeing as sagging, because all the fat compartments, the muscle is sagging down, and a non-surgical procedure is going to be working in that plane in between, which causes some scarring in that area, and then I have to deal with it, which is I have to address it and release it in order to get the best lift. The last thing that I want to mention, a procedure that you should be telling your surgeon about, is thread lifts. And thread lifts are becoming more and more common these days. And some of the procedures with the thread lifts are more superficial, and as long as they're superficial, it shouldn't have as much of an effect on your result, but you would still want to let your surgeon know, because let's face it, if I'm doing the surgery and I'm seeing unusual stuff right under the skin, I want to know what that is, so I'm not, worried about having to remove some sort of tumor or cancer or something else going on. So these are things that you want to set your surgeon up for success. Let them know exactly what you've had done in the past, and you'll want to know what your surgeon will do about it and how to address it so you get the best result possible. Thank you for tuning in. This is Dr. Kristina Tansavatdi, and you can find more videos on my YouTube channel at Facelift Expert. Thank you so much.